the government is hoping that artificial intelligence will help the NHS save lives by catching cancer early and cutting waiting lists.
Almost 700,000 women are expected to take part in a trial to speed up the time it takes for radiologists to review mammograms. And the Health Minister Karin Smyth joins us now. We've been discussing all morning the trial, the use of AI, the importance of improving the way in which we detect cancers, breast cancer. But, of course, what our viewers want to know is what happens if you actually have had a test which has a positive result. The radiologists' body says that there are 1,900 fewer consultant radiologists than we need. The government is committed that 85% of people should, if they've had a diagnosis, get treatment within 62 days. But for breast cancer, almost 30% of people are not getting treatment within 62 days. If it's for lung cancer, 42% of people don't. For gynecological cancers, 50%. So at the moment, even if your AI trial works, how can you reassure people they will then get the treatment they need on the timetable you've set?
Well, we do know, and Lord Darcy's report in the summer highlighted quite how bad the health service is about being able to treat people and get people diagnosed and treated on time. So some of those statistics you pointed out obviously are part of that, what we called, when we came into office, seeing that the NHS was broken, but critically not beaten. So we're getting on with the job of trying to resolve some of those problems. So workforce is a critical part of that, making sure we've got the right people in the right place. Prevention is a critical part of that as well. But using technology, which we often talk about in an abstract way, like in this trial, is also a key part of what we want to see in terms of reforming the NHS so that it can cope with the current demand and indeed increase in demand, because 1 in 2 people are going to get cancer during their lifetime. So we are really excited about the prospects from this trial, because it will allow us, rather than having 2 radiologists to look at those results, to have 1 radiologist and use AI technology. So that will really help with some of those statistics that you outlined. Women can be assured, I hope women do come forward and we want to be part of this trial. I think they will, but they will be assured that it is a well-run trial that will be checking those results, making sure it's safe, and so that they can get a faster diagnosis, faster treatment, and then from that hopefully save more lives. That's what we're about. And using, breast cancer is part of this trial, but really looking at AI for all sorts of diagnoses, treatment pathways, but also making the whole health service more efficient, which is what we announced a few weeks ago in our elective reform plan, using the app more, allowing patients more freedom to get appointments and so on. So a lot of efficiencies to be gained in the system by use of technology.
Can I ask you about another story that is in the papers, in fact, this morning? The Times has this story that the NHS is refusing to publish in full a report exposing failings in the treatment of Valdo Calacane, who is the paranoid schizophrenic who murdered 3 people in Nottingham. Now, the NHS says they're not going to publish because of patient confidentiality. I wonder if you could just offer your view on this as a health minister. Has he not sacrificed his right to medical confidentiality because of his crimes?
Well, this is a really tragic case for those families, and they have pursued justice and more information. And families do want to know what went wrong, and I think that is right. In this particular case, the perpetrator, a lot of evidence about his treatment is already in the public domain.
So why won't the NHS publish the full report? Surely it's important for everyone to know the failings in this case. It's of national significance.
As my understanding in this case is that the family do have access to that report.
The families do, but we're talking about this being published so that everybody knows what went wrong in this case. And in fact, the families are calling for the full report to be published.
Yeah, because they, I guess, and I don't know because I've not seen that report, think there are lessons to be learned in the public interest. I think that's a conversation.
Would you urge the NHS England to publish the full report?
I think it's a conversation that needs to continue around transparency. I think it is right that families and the wider public have confidence in our health system. So if there are particular reasons that I'm not aware of that information is not in the public interest or in the public domain, I think that does need to be considered as part of that ongoing conversation between the local NHS
and the public interest trumps the medical confidentiality of the convicted killer.
Well, I don't think we should talk about trumping things in a dialogue like this. I think it's important that we are transparent about treatment.
One right has to be preeminent, doesn't it? Either the public interest or the individual rights of the killer.
The overall interest has to be that we learn lessons from things that go badly wrong in the health service.
So you would urge it to be published?
And that the families have reassurance that all lessons have been learned and the same thing doesn't happen to other people.
Can I ask you about another story? The Prime Minister was asked about it last night. It's in a new book by Patrick Maguire, Gabriel Pogren, called Get In. And it concerns what happened at Christmas 2020 during the lockdown. Boris Johnson had announced that London and the South East had gone into full lockdown again. And that book reports that on Christmas Eve, the Prime Minister had a visit from his voice coach called Leonie Mellinger, and that she qualified, according to the book, for key worker status. At that time, we weren't allowed to meet families and friends in more than groups of 6, and people weren't going to work other than for key workers. When you look up the definition of key worker at the time, these were people delivering vital frontline services. Now, you as a health minister, talking all the time to nurses, to care workers, key workers, if they are angry that at the time the Prime Minister's voice coach was treated as a key worker and say, what are you talking about? That's ridiculous. What would you say to them?
Look, it was a terrible time for all of us, wasn't it? And we're starting to see again the sort of mudslinging that we saw before by some of the Conservatives around that at this time when we know that there were actual real parties going on at this time.
And I'm not a Conservative, and I'm just reporting what's in the book. I'm just asking, factually, is the Prime Minister's voice coach a key worker on Christmas Eve 2020? Yes or no?
So my understanding of the Tier 4 at that time in London is that people were working, and that this was part of working for presentations that the now Prime Minister had to make.
Well, I actually think if you look up the definition of key worker at the time, it was those needed to run the justice system, religious staff, charities and workers delivering key frontline services. And in government, administrative occupations delivering effective delivery of the COVID-19 response. Now, is the Prime Minister's voice coach vital to delivering a key frontline service or the effective delivery of the COVID-19 response? Because that is a key worker.
So my understanding is that at that time at Tier 4 in London, that people were at work for work-related reasons.
So not just key workers?
My understanding is that people were at work for work-related reasons.
So when the book says that it was OK because she was a key worker, you're saying it was OK because she was a worker, whether she was a key worker or not?
I can't comment on the book or where the journalists had that information from. I mean, that is a bit of a hypothetical for me at this point.
OK.
All right. Karin Smyth, thank you very much indeed for joining us this morning.